many people wonder who an anesthesiologist is, right? So imagine you have to undergo a surgery, right? Many people think of that procedure and what it involves. The person who will come to their mind first is the surgeon, right? Yeah, but there's someone in the room who is very important. That person in the room is your life support, right? So they ensure that you're alive as the surgery is going on. They ensure that you're pain-free, right? And they watch over you throughout the procedure. So in short, that's an anesthesiologist. One of the misconceptions that people have about anesthesiologists is that all they do is put you to sleep, okay? So we do much more than put you to sleep. So we watch over you, make sure you're pain-free, and we are, in short, your life support. When you're coming in for surgery, we have a number of things that we can do to ensure that you are safe and that it happens in a way that you don't feel in pain. So the first option that we have is general anesthesia. So in this, in short, we put you to sleep completely, right? The other option is something we call sedation. So in sedation, we give you some drugs that make you sleep, right? You're calm, and if you're aroused, you can respond, okay? So you can think of it like as a light sleep, right? Think of sedation like as a light sleep. Then we have regional anesthesia. So in regional anesthesia, we block the nerves in the area that would like to work, right? And that area remains pain-free as you work. Then we have spinal anesthesia. So this is commonly known especially to mothers who undergoing cesarean sections. And in spinal anesthesia, what happens is we give you an injection in your back, right? And that numbs the lower half of your body. So the surgeon can work while you're numb, right? Not feeling any pain, but you can still talk to the anesthesiologist. You can still, you have a sense of what's happening in the room, and it's safe for you also. So those are the options we have: general anesthesia, sedation, regional anesthesia, and spinal anesthesia. So we also do work in the ICU, all right? So imagine patients who are very sick and need some kind of organ support. So that's what we do in the ICU. We also work in the emergency care setting, right? So patients who come in with some kind of emergency, could be respiratory, could be cardiac. And if you remember very well, during COVID-19, the anesthesiologists were very vital in making sure that patients were taken care of. And when everyone thinks of COVID-19, we remember it as an emergency situation. We also do pain management. So pain management, both acute means short term or in the short term. So you can think of pain management after surgery, or pain management for conditions like sickle cell, for example. We also do chronic pain management. So if a patient has pain that has lasted for more than 3 months, they will need some kind of pain control that is not just the painkillers that they'll take orally, but they may need advanced techniques to control their pain. So the anesthesiologist comes in for that as well. We also do something we call labor analgesia. In short, this is pain-free delivery. So yeah, these are some of the options that we have in stock for you.